All right, so good morning, everyone. Welcome to the Considerations for Anti-Violence Programs Using Technology During the COVID-19 Pandemic webinar. Today's webinar is hosted by the BC Society of Transition Houses, and we are pleased to have close to about 200 people now registered to participate and join us from across BC today. So this webinar is being recorded and it's in listen-only mode to protect your confidentiality. We will also be posting the recording of this webinar on the www.bcsth website so that you can refer to it at a later date and share with your colleagues or folks that aren't able to join us today. If you have problems logging in or hearing, or if you have a question, please post those questions in the chat box on the left-hand side of your screen. I think I can see a lot of folks sending questions in the chat to just all panelists or to myself. If you could change that option in the chat to sending your question to everyone or to Nikki, that would be great, so that she can see all of your chat questions, because I can't exactly see them on my screen right now that I'm sharing my PowerPoint with you, and she'll be able to assist you with any questions there. So that's great. So my name is Rhiannon Wong, and I am the Technology Safety Project Lead for the BC Society of Transition Houses, and helping me answer all of your questions is my colleague Nikki Bowman. So because this is a recording, again, please type your questions in the chat box and we'll get to you as soon as we can. Okay, so for those of you who aren't familiar with the BC Society of Transition Houses, we are a provincial nonprofit association that supports over 200 members across British Columbia. And our member programs include transition, second and third stage houses, safe homes, and the prevention, education, advocacy, counseling, and empowerment or peace programs for children and youth experiencing domestic violence. And our office is located in Vancouver, and we're on the unceded territory of the Coast Salish people. So BCSTH supports our members through an array of projects aimed at giving frontline anti-violence workers the tools they need to meet the changing and growing needs of women and children experiencing gender-based violence. Since 2007, BCSTH has had a technology safety project that addresses the intersection between a perpetrator's misuse of technology and violence against women. We do this through research, resource development, and training. And we also advise anti-violence organizations on their use of technology, which is how this webinar particularly ties in to our work. So we could not be able to do our technology safety work for the past 12 years without the generous support of the Safety Net Project at the National Network to End Domestic Violence based out of Washington, D.C. In fact, some of you have probably got to see Audace Garnett, one of NNEDV's technology safety specialists, speak at our past annual training forum as a keynote speaker. NNEDV started this work in 2002 as they saw a need for education and awareness around how technology was being misused by abusers to stalk, harass, monitor, impersonate, control, and terrorize women and children. During the COVID-19 pandemic, they have also been leaders in researching, assessing, and developing digital service material for anti-violence organizations around the globe that consider all the technical and privacy and confidentiality considerations we all must have in the forefront of our mind when we're moving forward with digital service provision. This webinar and our new digital services toolkit, which is going to be launched later today, has been adapted for Canada, specifically BC, with the support and cooperation of NNEDV. And we at BCSTH are super fortunate to be able to continue to work alongside NNEDV as well as our international sister technology safety projects that are located in Australia, Ireland, and the Netherlands. So what exactly are digital services? For the purpose of this webinar, and because of who we're supporting in our organization, we've defined digital services as the use of technology-based tools such as online chat and text messaging, video calls and communications, and mobile phones and devices to provide support services to program participants of anti-violence programs. Because during this COVID-19 pandemic, BCSTH has been asked questions almost daily about digital services from our member programs and from some of our partner organizations across the country. And many folks are asking us, what are the best options to add text or online chat to their crisis line, or how can they use a web-based text or online chat for program support? Folks also want to know how to provide anti-violence support services through video in a safe way. And it is possible to use these is it possible to use these video platforms in a group support setting? And people are also asking us, like, should we continue to email program participants or text participants through our own devices and our office technologies? So there's no easy answers to those questions because, as we know, anti-violence programs across the province provide a huge array of services. Programs have to determine what type of digital platform aligns with the deliverables in their mandates. We also need to take the time to analyze our program or our agency's capacity to deliver these services, and take the time to investigate if women, youth, and children accessing our services will or can use the tech, as well as thoroughly investigate the privacy and security policies of each digital service vendor. So in our short time together, we aim to provide BC's anti-violence workers with information that can be shared with their team so folks are informed on the risks and benefits of various digital services, and provide everyone with helpful information and resources to make the most secure choice for their program. So for some of the programs that are listening from outside BC, or you're not an anti-violence program, and I know that there are a few from the registration list, we will be referring to BC's Personal Information Protection Act, also known as PIPA, as the majority of anti-violence programs in BC have privacy obligations under this law. So folks in other jurisdictions or not an anti-violence nonprofit program may need to investigate your local privacy laws before you begin digital service. If you're not an anti-violence program, but you are working with people, the same benefits and risks of digital platforms, as well as our recommendations, probably will still apply and be beneficial for you. So before we get into the big answer that we've been getting for a few weeks now, which is probably, as Nikki would probably agree, is Rhiannon, what is the best video platform we should be using? We really want to encourage all programs to take a deep breath and do an assessment of your agency's readiness and decide what kind of digital service provision best suits the needs of your program. So first thing we need to do is identify the program your agency is trying to solve, which is probably for a majority of you, how to continue to provide essential services during a time of social distancing and remote work. And figure out what are the options that will make our programs more accessible to our participants. So for example, there's so much pressure to start support services via video, but if your team doesn't have high broadband internet at their home, or neither do the folks you're supporting, then another option makes way more sense. Because when you understand how video technology works and the technical requirements of it, if there is no broadband bandwidth internet, video conferencing doesn't necessarily work properly. Another consideration is, does the team have the equipment it needs to be able to provide digital services? So this could mean such as agency-owned computers or laptops or tablets. Do they have high-speed internet? Do they have a cell phone, a webcam, a microphone? And do folks know how to work it? And are the security features like antivirus and malware set up on these devices? And this is really important when we go and talk about our privacy obligations under PIPA. And I think I'll save what I want to say about that to that section so we don't jump back and forth. But keep in mind, yeah, we have to do our due diligence and have the security features put onto our devices before we start digital service provision. Another big consideration is, does your agency have funding to keep the digital subscription going for a few months or a year, or however long this pandemic is going to keep us working remotely? There are various price differences on a lot of different platforms. Some are free, some are super expensive. So we have to consider all of that as well. We also need to take the time to review the privacy policies of all of the vendors that we're looking at, and ask them questions so that you can compare the platforms. So for myself, if I can't find an answer to, does the vendor sell client information in their privacy policy? And I've emailed the vendor to ask clarifying questions about, do they sell our clients' information? And the answer back is not a no or even a yes. And it's, I get a vague answer, or they just don't reply back. Then that's a huge red flag for me to begin service on that digital platform. The Office of the Privacy Commissioner of Canada also suggests that agencies create internal policies for using the technology and train staff on how to use it properly before it gets used with participants. And this makes total sense, especially when we are complying with BC PIPA and doing everything we can to prevent a privacy breach. And a great example from our research and comparison of different platforms is some platforms require workers or users to go into the settings every time to turn off do not collect data in my session button before they begin service. So our team needs to know that, and they need to know where to go and how to do that, and that needs to be written in our policies. So we also need to test our tech before we start using it with folks, so that we can support all of our participants if something if something does come up that prevents them for using it. All right, so the path we must choose. So whatever platform or combination of products you do end up choosing, you must be able to meet people where we're at. We've participated on a lot of regional calls lately, and there's varying differences in communities about folks that have access to technology and folks that have access to internet. We need to also assess whether these platforms meet accessibility or interpretation needs. So for example, if you are part of a multicultural organization and you provide service in a language other than English, does the platform support the characters of the language you're doing services in? If you're working with folks with other accessibility needs, if a woman needs a sign language interpretation, can the video platform that you're using support more than one caller so that simultaneous sign language translation can happen at the same time that you're providing service? We also need to offer low-tech options if folks aren't comfortable using technology, or it's unsafe for them to use the digital services your agency is offering, or they just don't have the tech. And we also want to provide participants with the information that is required to be provided to them through our PIPA obligations. And again, we'll talk about that after we talk about all of the different platforms. So, so now we've moved along in our process and we've assessed our organization, we've assessed all the platforms that we want to use. We want to think about all aspects of safety and privacy and working with women when we're providing digital services. So one of the big questions that always comes up is, how do we prevent interception, impersonation, as well as keeping our employees safe? So when we're thinking about interception, this means someone being able to access your session. This can happen in a variety of ways. Interception because the abuser is monitoring her device, or interception because of third-party hackers. So usually this can be determined with the kind of encryption the platform is using. And here's your tech safety tip. You don't want to be using any kind of platform that's using anything below end-to-end encryption. Though zero knowledge encryption is best, but that's more about the collection and storage of information. For those of you that aren't familiar with encryption, end-to-end encryption is basically a computer security community standard that means that only people that are party to the communication can access the session or the communication. Not the middle person, like not your vendor, not folks that work in the server farms, just you and the participant that you're supporting. You also want to be very careful about the types of and definitions of end-to-end encryption. So I know lots of people have questions about Zoom. So Nikki's going to post a research report from one of our partners from our Stalkerware project, from the Citizen Lab at the University of Toronto, who did a big research test on Zoom. And they talk about how Zoom's definition of end-to-end encryption doesn't meet industry standards. And so we'll talk about it in a little bit, but I know that folks are probably going to be asking those questions. So that information is there from the Citizen Lab for you to go through with your agency if you're choosing to use Zoom. Okay, so secondly, I guess after that, we want to think about ways the platform we choose can make it easy for someone to impersonate the person you're supposed to be supporting. So is the person you're chatting with really the person you're supposed to be chatting with? And how, as a agency, how can we determine that, or how can we work with women to determine that it is them that we're working with? And this really does apply to folks that are using text or web chat or SMS chat-based services or email even. Some of the best practices say that we need to talk about code words and passwords or and things like that. So those are some safety planning things that we can work with women about. Thirdly, we want to think about our privacy obligations under our privacy laws. What does the vendor do when they collect and store and access the personal information of the person that you're supporting? All platforms that we've compared collect your agency information. And this makes sense unless you're giving them your confidential transition house address, but some platforms collect the personal information of the participants that you're working with and some don't. Some store your sessions on their servers, others don't. Some vendors access the personal information that they store, others don't. Some vendors sell and trade the information or say that they will email your participants with like promotions and offers, and others don't. So agencies have to know the answer to all of these, because under PIPA, you're obligated to inform your participants of all of this before they agree to begin service and digital service provision. And we'll talk about this more because we really want to make sure folks are obliging by their confidentiality obligations. So lastly, we want to also consider our employee safety and their privacy. We've been saying this for a really long time. Agency-owned devices are not only recommended to prevent privacy breaches, but employees' personal phone numbers shouldn't be accessed by participants outside of appointment time. And we have to think about ways that our team members can create workplace and personal boundaries, especially when now our personal spaces are our workplace. So when we're choosing the right platform, um, so okay, so now that we're choosing, sorry, I'm changing my mind of where we want to go. So we've already talked about understanding platform privacy policies, and I've put a graphic on the left-hand side of your screen. It's super, super tiny, but if you look very, very closely, it says privacy policy. And this is a screenshot taken from an actual platform website, and an example of where you are most likely going to find your vendor's privacy policy. So you really need to look for it. Tech. So tech that's okay. Another consideration that we want to consider when we're choosing a platform is that tech that's okay for personal use doesn't mean it's safe to use with participants in our program. So some video chat platforms people use to talk with their family and friends, or even within your organization between staff, because there aren't huge safety risks there. And that's okay to totally use them. But that same program that we are familiar with may not be safe to use with participants because of the way they collect and store or have access or sell the personal information they collect. A lot of video platforms, and we're going to get to all of them, are sold as telehealth platforms, especially the Canadian-made video platforms, which are meant for medical professionals or doctors. So they offer a lot more options like charting and case notes and file sharing, which can all be super handy until you read that privacy policy on how they collect and store and access the personal information that you're inputting into their platforms. So if you're looking at purchasing a telehealth platform, you want to think about the restrictions and the policies that your agency is going to want to put in place for functions that folks on your team can and can't or should not use, or even better, inquire about turning these features off. We did a call with a telehealth platform yesterday, and after their sales pitch, I said, well, can we customize it? Can I change the names? Or change all the labels, and can I disable certain functions? And they said yes. So you have to be able to ask those questions if you get red flags and you think that some of their options will put or increase safety risks. There have also been documents from other organizations going around saying that if you use paid versions of certain platforms, it's okay. And I encourage you to investigate all paid options of all the platforms and all of the different types of plans that each platform has, because not all paid plans are created equal. And this is because when you read through the plans and you read through the privacy policies for each plan, which we've done, you know, there are big differences between $20 a month plans, free versions, and the $200 plans. So basic paid plans versus telehealth plans have big variations in the collection, storage, and access and selling of your personal information of your participants, and if they will offer end-to-end encryption. So I encourage you folks that are looking at platforms that have various different plans to do your research before we just pay. we think that we're protecting our participants' data when actually our platform is sharing that data with Facebook or other social media companies. So safety issues to consider. So after we've decided on our platform and we're informing women of any of the potential privacy risks associated with that platform that we've decided that we're using, we have to safety plan, have those safety planning conversations before we use that platform so that she can determine any potential risks to her safety. And we're gonna go into the specific risks of various types of digital service provision. But generally, for example, we want to think about, does the abuser have access to her device, and could it be monitored at all? And we have some information sheets on our technology and privacy safety toolkit, which I'll show you later on how to assess if your devices are being monitored at all. We want to know if can the abuser access her online accounts if the platform you're using requires her to create one. We want to know if she participates in digital service provision. Can anyone overhear her conversation? It's important to consider for folks working at home too. It may be a privacy breach if someone from your home overhears your session. So those are internal policy questions that need to be asked and clarified and determined. Because if there is a privacy breach, either from a company or your agency, and if her personal information does get out there, or she's not ready to disclose to the public that she's experienced abuse or violence, there could be risks to her safety or other unintended consequences. Okay, so I realize that I may be sharing information that may cause folks to say, forget it, but this is not our intention at all with digital service provision. Not only do we have a short time together, but most folks understand the clear benefit of digital service provision. Otherwise, we wouldn't be participating in this webinar together. And we want to inform you of what we want to inform you of are the risks so that programs are able to pause, do their research, and launch a solid digital service delivery in the most secure way possible while protecting the confidentiality of the folks accessing our services the best they can. Every single digital service product has benefits and risks, and I'm sorry to say, there is no clear winner, because I'll show you some comparison charts in the end. You're going to have to determine which platform is the best for your agency and the people that you're supporting. So this section, in this section, we're going to break down the benefits and risks of the main digital services that agencies are going to provide or thinking about providing. So we're going to start with the basics. Why can't we just text folks? There are benefits to texting if done properly. And many folks talk about how, their number of calls are down because now when women are at home, it's not necessarily safe to talk to someone, or they don't have a lot of time to talk to someone because, they're homeschooling now and working from home, and there's just, there's not a lot of time to do so. So, texting is useful if folks need to communicate in a discreet way. It also may meet accessibility needs for those folks who aren't comfortable speaking English but can type, or for those who are hard of hearing. But this should be done on an agency-owned phone because if anyone, for example, family, friends, or colleagues, accidentally sees a text or an email or a client name or their phone number, this can be a breach of confidentiality. Which brings me to instant messaging. A lot of folks over the years, not just now, have commented things like, well, she just wants to chat over Facebook, or, we're just going to use WhatsApp because everybody has it. But I'm going to give you an example here. So specifically when we talk about Facebook as a company and their apps, Facebook asks for more permissions than an average app in order for you to be able to download the Facebook Messenger app that's required for you to communicate and chat with another Facebook user. So if you have the regular Facebook app downloaded, you've already agreed to nearly all of the permissions that the Facebook Messenger app requests. And the problem is that, with using Facebook is it is definitely accessible because a lot of people have Facebook already, but Facebook has, uh, Facebook, okay, so what I'll say is that Facebook uses information that they gather about each individual, including yourself, so that they can sell to third-party companies. And they've been transparent about it, and we've given them permission to do so by accessing their services. And so, in Canada, we're lucky we have different privacy laws, but again, like, you never know what information gets commingled. So, through Facebook Messenger, if you took the time to read through the, do you agree to use this service and give us permission? What it would say is that we've given Facebook permission to, read your text messages or take pictures and video or record audio or read calendar events, and plus other things that might be on your phone. And I use Facebook as an example because you can do a quick Google search of Facebook Messenger and security, and you'll see a whole bunch of articles come up. So it's something that's, not new to folks. But it's when you're using third-party instant messaging apps, it's not just Facebook that asks for these permissions. Facebook is just an easy example, which I just said. So if you are going to instant message with folks because it is, or your agency has determined that it is the best way to access and provide service to some of your program participants, whether it's through Facebook or WhatsApp or Skype or any of the other instant messaging platforms, there's so many out there. It should only be done on an agency-owned device and with an agency account or phone number. We don't really want to be using chat with our personal phone numbers or our personal Facebook accounts, for example. So we're going to set up something like Rhiannon BCSTH, a Facebook account or something like that. But there are safer ways to instant message and chat with folks and to text with folks. So we will get into that in just a minute. Additional considerations for texting and instant messaging, I've lumped their safety tips together because they're virtually the same. When we're setting up appointments with folks via text or chat, we really need to consider that conversations tend to be longer. So what would happen in a 45-minute in-person session might take 1.5 hours via text. So we need to schedule our appointments appropriately so our workers have time to process, breathe, take a break, have a snack, go to the bathroom, get the support they need so that they're ready to start their next session. We want to have conversations with our participants about what will happen when there are long pauses in the chat or the chats go inactive and when the communication stops. So what will you do when she sends a text or a message that says, help, I'm going through this, I need something, and then there's nothing for long periods of time. So have policies or have conversations about when you're going to close the session and if it's safe to follow up via phone call or how she can follow up with you. Text and instant messages also tend to have more descriptive disclosures. So folks may also, which folks need to be, I think, prepared for. And also, something to consider is that the participants that you're working with may also disclose experiences to you before you can pause, which you might do in like an in-person session and say, thank you, but if you disclose any of these three things, I have a duty to report. And so because of this, you need to think about how you really need to preface your conversations and let women know before you begin service, what if there is any duties to report, and what you're going to do and when chats go inactive. So also in terms of our agency, we want to think about, because disclosures tend to be more descriptive, we need to have support plans in place for the anti-violence workers in our program to be able to debrief at any time when needed. Sorry, just so much to say. I'm like losing my train of thought because I'm talking to myself. So there are risks and texts of instant messaging. I've listed them here. I'm not going to go over them again because we've already talked about all of this. So I'm just going to leave this here as a place marker, and you can refer to if needed. So recommendations for text and instant messaging. Offer additional ways to communicate that is more secure, like web chat or phone conversations. If you are texting or communicating through some sort of instant messaging plan, you always want to delete the history of your conversations after you've finished. You don't want to save the names and numbers of your program participants in your devices, and check in regularly to make sure that she may agreed to be texting last week, but this week things have changed, and so it might not be a safe method of communication for her anymore. Again, use agency-owned devices and create agency accounts. Research those privacy policies, and don't automatically back up your text conversations to the cloud, because text messages and history of apps downloaded can be shared and accessed on many devices that have access to the same cloud account. So this photo is an example of Apple products. Folks using any of these devices can access a person's email or text message or photos or videos by simply knowing a person's Apple ID and password. So, it doesn't just apply to Apple devices. It happens to Android as well. It's just that there's so many different brands of Android phones and versions of Android phones within the brand. So it's hard to pick one and put it on a slide set. But, just consider that, if your device information or her device information is shared or backed up in some sort of cloud storage or Google Drive, or she has shared calendars, or again, the iCloud here, the abuser can go into the cloud and see what's stored there. So, before we begin services, again, we want to ask, does the abuser have access to her cloud accounts and passwords? You want to ask her to check her devices to see what ID is set up in those settings. And there's a screenshot example here on the right-hand side of your screen. If it's an email address or Apple ID that's not hers or that she didn't set up, it's really easy for her to set up a new cloud account on a safe device that's not being monitored. And it's probably best for her to change her passwords on her device anyways, as just sort of a recommended practice. All right, so moving on to email communication. Email is something that we use all the time. It's not new. There are clear benefits to email. However, it's not that great for providing support services to folks. Most email is not encrypted, um, which we talked about the definition of encrypted. So this means, there are various folks or companies that may be able to read or access your emails if they want to, while in between the time you press send of that email and the time that the person you're intending that email to go to receives it in their inbox. Um, Other things to consider: the abusive person may know her password to her email or have access to the device. Many of us today have our emails set up on apps on our phone that don't require us to put in a password every time we access our email. And email is saved in a lot of different places, like cloud storage and on different devices. My work email here at BCSTH is stored. I can access it on an app on my phone, on my laptop, and my work computer, and the computers of any BCSTH laptop. So, we want to think about the access and places where our emails are stored. Often when we delete our emails, they aren't really deleted until we go into our trash can or delete folder and permanently delete them. So we want to remember to do that when we're communicating with our program participants. But again, don't restrict emailing with program participants as a general practice. Although email has risks, refusing to email with participants is not the solution. Let the program participant determine the means of communication that can best accommodate their ability, their access, their needs, and their preferences. There are recommendations to have safe email practices. So they're really quite simple. You can delete the email, the initial email, or any previous thread when you reply. This way, if the email does get intercepted or accessed by the abuser, the request for assistance or the entire history of the conversation isn't revealed. You want to include information about the risks related to email communication and discuss email safety and privacy with participants, encouraging them to delete the messages they have sent and received and to clear out their deleted folder. You want to ask if there are safer ways that you can communicate with her. For example, it may be the only method available to get help, but for others, a phone call or an in-person visit might be safer. If communication continues, check in periodically to see if email is still the safe and preferred method of communicating. You don't want to store participants' names and email addresses in your address books. And if you must print out the email exchange, thread the email conversation as soon as you no longer need it. And double delete your emails regularly, like go into your trash or your delete folder and delete those messages periodically for sure. Okay, so chat and text messaging platforms. We're now going to talk about these, or sometimes they're the same thing depending on the vendor that you're using. And this is where we get into the new for many agencies in terms of digital service provision. These options are becoming increasingly popular because some programs are reporting, again, that calls are down, probably due to social distancing and perhaps being at home with the abuser. So when we refer to online chat, I'm referring to a chat conversation with someone over a web-based browser platform that's dedicated to your agency or your program. So the program participant would connect to you via your website or have a link provided to them in an email. And once they click on that link, you would be typing your conversation back and forth. Many online chat platforms were designed for service provision have two capacities. So the first one is that people can connect to your agency via chat or text for the purpose of a crisis line or hotline. And this is increasing because, as we know, it might be easier for folks to text or chat with you on your website than through a phone. So many agencies are moving to online chat crisis line as an option. And that's something that has definitely come up on a lot of our member listservs. And secondly, a second option is that your program can use these chat platforms to provide one-on-one service provision, either through the chat or SMS text option on a one-to-one capacity. So for web-based chatting, a person can chat back and forth with an anti-violence worker online through the internet. So think about, for those of you who are not sure what I'm talking about, think about when you go to a consumer website, like an online shopping website, or even like Rogers or TELUS website, or if you've had to cancel your recent vacation and you're trying to talk to someone at like Airbnb or WestJet or Air Canada, there are options to talk to someone through live chat. And you click on that box and you start chatting with someone on the other end. Sometimes it's quicker and you don't necessarily have to call and wait on the long call line volume to the call center. So this is an example of a web-based chat. What's an increased benefit of online chat is, unlike email or texting, the messages on some platforms are end-to-end encrypted, and once you close the chat, the whole history of the conversation is erased from the participant's device. So there's no record of your conversation, unlike text or another third-party messaging app that just kind of stays on your phone until you decide to delete it. The second option that some online platforms have, or chat platforms have, is SMS text-based messaging. So this is what I meant by there are safer ways to text program participants. So the person who is trying to access your service will be provided with a text number, and they will be able to text their support worker or the crisis line, however you decide to set it up. And the support worker will be able to chat or text back with them using text or the web platform through your laptop or your computer. There is a cost associated with SMS-based text messaging platforms, but they are minimal, and I'll show you that in a few minutes. But like all technology, there are risks to chat and text messaging platforms. Some allow chat messages to be saved or copied unless you turn the function off. So again, depending on your platform, you need to understand how that technology works. Text messages can't be encrypted, so that's something to think about. Only web chats can. But with some of these platforms, they will encrypt the message on their server or while in transit from one person to another. In terms of the collection, storage, access, and selling of personal information, some chat platforms don't collect any participant data, and others do. So you just have to be mindful of that. So on a side note, people do ask me all the time, how do vendors collect the personal information of clients? And basically, when we're talking about chat and video platforms, when a program participant is required to either download an app or download the program before they need to, if they need to download an app or they need to download the program before you begin digital service provision, that's when the vendor company collects that information. And in terms of personally identifiable information, if the platform that you're using requires your program participants to create an account in order to access services. This is when your vendor collects and stores women and children's personal information, and then you have to refer back to their privacy policy to determine how they've laid out how they're going to access it or share that information. So here's a screenshot of options. This is the screenshot of the Kids Help Phone website. So the pink live chat button here would be how people would access your services via chat. So if you click on this pink button here, it opens up a chat box and folks can begin chatting with a support worker. This green button that says text, if you click on it, it'll give you a 6-digit number to start texting somebody on the other line, and you can begin texting someone on the Kids Help Phone. But if you are interested in adding online chat or SMS text services to your crisis line or use it for your counseling sessions, next Friday, Dylan Black of the Ottawa Coalition to End Violence Against Women, who has been in the news this whole week actually, has been an instrumental part of creating Unsafe at Home Ottawa, and they've pretty much produced an online crisis and text line for women experiencing violence in Ottawa. And so they're going to be our webinar guests next Friday at 12:30 Pacific Standard Time. And so in your, I think Nikki's going to put a link so that you can review unsafeottawa.ca, the platform there. But if you are interested, I'll add the registration link to the follow-up email so that you can register and join us and learn about the process of developing their crisis line via online chat and text messaging. Okay. So recommendations for online chat. When you're using these programs, your recommendations are to collect the least amount of information needed to provide the service requested and keep the information for as short a period of time as possible. If you do happen to choose a digital platform that requires an account, and there's lots of digital platforms that don't require program participants to have an account, ask the vendor to customize the account form to collect the least amount of information possible, because honestly, you probably really only need an email address to be able to begin service. As a frontline worker, you can get all other information from your intake form or your phone conversations. You know, that can all be filled out over the phone. It doesn't need to be filled out on a telehealth platform. So don't store unnecessary information on any vendor server, whether it's, you know, Ivernet or DoxyMe or Zoom or whatever you choose to do. You know, have policies about that and ask questions about, you know, how some of these features can be turned off or not used. Choose a platform that doesn't store the content of your conversations. A lot of your platforms, some of the platforms don't collect the content of your conversation, but they'll collect like the date and how long your conversation was. So not collecting any personally identifiable information. And check if the platforms collect incidental data. And these are mainly for, you know, platforms that ask you to download apps or download the program before you use it. They're going to be they may be collecting the IP address of your program participants, their device type, and general location information. So you want to investigate that. And choose a platform where employees or the company cannot see or retrieve the content of your chat. So what I have up here, oh, I probably had the wrong screen up. So that's what I wanted to say. What I've got here is our online chat comparison chart that we've done, and it's going to be hosted on our digital services platform. So here you can see we've got two video conferencing platforms here, and we've compared them based on their features and their functionality, their cost, their end-to-end encryption, and it's not listed here because I don't want to take up that many PowerPoint slides, but we've also compared these two digital communication platforms, or these online chat platforms, with their collection, storage, access, and the buying and selling of information. So that's all there, and an example of our comparison chart for online chat. So I talked about that, even though the slides wasn't up. I'm sorry about that. Online chat planning and safety planning are the same considerations for text and instant message. The only thing I might mention here is that, if women are texting via the online chat platform, make sure she knows to delete your conversation on her end. All right, sorry about that. Oh. All right, so we are close to time, and we are, so we're close to time. So we did start a few minutes late, and I'm almost finished. So hopefully you'll stick with me here because we're going to talk about video-based communication. So video conferencing is a tool anti-violence programs can use to communicate with program participants who face barriers to accessing services or in a time of social distancing through video. The benefits of video-based communication is that, it is more personable. It may help with accessibility, especially if the video platform provider provides a secondary connection or more than one connection, so that you can have live sign language interpretation happening simultaneously. It might be great to support younger children for those of you who are. And of course, there is a decreased risk of impersonation. But as you could guess, there are risks to video. Some platforms, as you've probably seen in the news lately, are truly not end-to-end encrypted. And there's a difference between industry standard and those that define their own their own levels of end-to-end encryption. So you need to think about that. Sessions can be overheard by someone in your space or theirs. Default settings may not protect privacy, so you want to go through those very thoroughly. Video platform vendors can collect your personal information if a person has to download an app or create an account. So in the top right-hand side of your screen, I just, because we use Zoom a lot here at BCSTH, I just took a screenshot of every time we use Zoom. Sometimes we're on like 4 or 5 Zoom calls a day. And so I just took a quick screenshot to show you what that looks like if you weren't sure. Some video platforms share your personal information between social media sign-ins and the video platforms. So this is really important because some platforms allow you to sign in by using Facebook or your Google account. And if they do, this is not a selling feature. And if you do choose to go with the vendor that does do this, you always want to work with participants to make sure that they know that they should not sign in to a video platforming program through their social media account or their Google account. Because by doing this, this gives both vendors access to one's information on the opposite platform. And that's something for you to know too. All of us shouldn't be signing in to other things via our Facebook or our Google accounts. Platforms may access your participant data that is collected. And If you can't find it in their privacy policies, ask, does the platform share, trade, or sell your data? Video things to consider in addition to privacy risks. One of the things that people say to us all the time is, well, we chose this video platform because it says it's PIPEDA compliant. And I think that's a huge misunderstanding of the market and the sales reps and the marketing, and understanding, what privacy laws in Canada regulate what. Because I've been speaking through this webinar, I've been referring to BC PIPA, because BC PIPA regulates the collection, use, and disclosure of personal information by private organizations such as our BC anti-violence programs. So PIPA doesn't equal PIPEDA. PIPEDA is the Personal Information Protection and Electronic Documents Act, and is completely different in that it applies to private sector organizations across Canada to collect, use, and disclose personal information in the course of commercial activity. So that's that's the big factor here. Our anti-violence programs are free. PIPEDA might apply to you if you're a BC clinical counselor who has your own private practice and you're charging people for your sessions, but that's a different set of rules than those of us that are counseling under FTV or PEACE, for example. Also, when vendors tell you that they're HIPAA compliant and use BAAs, that should tell you that they have no idea that what your privacy obligations are, or even what country you're located in. Because HIPAA is the Health Insurance Portability and Accountability Act in the United States that regulates their data privacy and security provisions for safeguarding medical information. So as you can guess, US-based privacy laws hold no standing here in BC. So BC PIPA doesn't have jurisdiction over whether data is stored in US or in Canada. And honestly, when your agency so basically what this means is, what your agency really needs to consider is how well the personal information of your participant is encrypted, collected, stored, and accessed. Because again, just because the technology can, doesn't mean you should use all of those features. So in the comparison chart I showed you for a long time during web chat, in that same comparison chart, we've also compared video conferencing platforms. So we've divided them into Canadian and US-based vendors. And what you should be aware of, and what I alluded to earlier, is that all of the Canadian-based vendors we looked at are telehealth providers. So again, this means they're made for medical professionals and do a whole lot more than what you might need. So we want to be mindful of that. What I kind of found jarring at first when we're looking at some of them is that the language that they use, they use words like patient and illness and diagnosis, which can be stigmatizing and inappropriate for anti-violence work. So you want to ask, are you able to change the labels? And some of them can, and some of them can't. For the US-based platforms, we've chosen 2 popular choices that folks are asking about, and 2 more secure platforms. I will mention here that we've chosen Zoom for healthcare as the comparison, because it does offer a different level of security and encryption than the pro and business and enterprise paid options of Zoom. So when you're looking at this comparison chart, it doesn't apply for basic Zoom plans, or the information here is not the same. So for those of you who are wondering if they can use video conferencing for group services, all of our video vendors were audited for group capability. So you will want to pay attention to that, and if they have that capacity, if they have that capacity. And then as you continue, like the web chat, to refer down through the comparison chart, it will go into how these platforms in both Canada and the US collect and store and access and buy and sell and trade the personal information of the folks that you're supporting. I'll also note here that in some of the vendor box, you'll notice that there's a phrase that says "not known at this time," and this is because after reading through all of the privacy policies, all the companies that we compared were followed up with clarification questions. So for those who didn't respond to our questions, or they didn't give answers that were clear, we put "not known at this time," so that this will hopefully trigger you to investigate further if you're exploring the use of them. Okay, so quickly, some recommendations for video calling. To manage poor internet connections, use a combination of video conferencing for video and then have folks phone in for the audio. So that way, if the video fails, the connection will remain. Develop a plan of action if the program participant has to abruptly end the session. Use agency-owned devices and create work accounts for the sole purpose of communicating with participants to maintain proper communication and limit confidentiality concerns. Create handouts and tips of how program participants can access the video conferencing service, and test the technology to make sure it works properly. Think through any other safety risks for video use. I put an image of FaceTime here on the right-hand side as a reminder for me to quickly talk about FaceTime, because I think it deserves a follow-up, because folks often talk about, is it safe for me to use FaceTime? So I'll say this. FaceTime, actually, the platform itself is pretty secure. It is end-to-end encrypted. But as you can see here on your screen, there's a record of all the FaceTime calls on your devices and in your cloud history. So again, if you are going to be using FaceTime on an agency-owned phone, you're going to want to do it on an agency phone, and you're going to set up policies about having to delete the history of those conversations, not back that up into the cloud, and create agency work cloud accounts, not using your personal ones, so that to prevent privacy breaches if this is the way you choose to communicate with folks. Okay, I know I'm like beyond time, so if you have to go, this is recorded, but I am going to keep talking about informed consent, because this is like the last 2 or 3 slides here. So if you can stick with me, that's great. I didn't expect this to go for this long. So we have a lot of questions about, how do we get informed consent from folks before we start digital service provision. I hope some of you recognize this image from the Incredibles movie, but we are not giving legal advice in this webinar, especially in this section. I did get clarification about our members' privacy obligations under BC PIPA from the Office of the Information of the Privacy Commissioner of BC, but again, this is not legal advice. And if you have follow-up questions, definitely reach out to the OIPC BC, because they're super helpful when it comes to your privacy obligations and informed consent. So as mentioned, we're talking about PIPA because that's what many of our members are obligated to comply to. So in terms of digital services, personal information is most commonly compromised when text messages and contacts remain on non-agency owned phones and friends and families have access to the device, when emails get sent to the wrong person, when you download an app or create an account, if our agencies are asking for too much information in the account setup of our platforms, when we use those charting or case notes or file sharing features of some platforms, and the platform collects and stores and has access to and sells and trades the personal information, or there is a privacy breach or a hack on the vendor. So in your decision to use a certain platform, an agency must demonstrate that you have reasonable security in place. So that's what I alluded to earlier about agency-owned phones and making sure that employees have everything that they need before they begin digital services. You have to be able to demonstrate through PIPA that you have those securities in place. So firewalls, antivirus, anti-malware, have passwords set up, that you have those policies in place. You should only use a platform with at minimum end-to-end encryption. We want to avoid, the OIPC said to me, you want to avoid platforms with known privacy problems, and agencies are, and it's really important to know that agencies are not responsible for the devices and platforms. So agencies are responsible for the devices and platforms which you are doing the work on, but you're not responsible for the woman's device. And so she needs to know that. She needs to definitely know that in case an abuser is monitoring her device or there is some sort of breach on her end. So in terms of informed consent must be meaningful, and this requires programs to tell participants about the platform and provide consent before they are using it. So in an agency's informed consent form, program participants must be informed of the platforms that you're using. You want to be specific, include all options. So you'd say, maybe she has a tick mark like about email or texting or online chat. Like it could be more than one thing on your informed consent form. Participants must know that your agency cannot guarantee the conversations with them will not be intercepted, and explain all security measures that your agency has in place. Folks also need to know any requirements that they must have in order to use that service. So a phone, what kind of device, the internet, if they need to create an account, if they need to download an app, any other specific specifications need to be in your informed consent form. Folks need to know any potential risks with using that service. So for example, yes, the program collects your information and can access it if need be, but it does not sell it, but it does share it, and you need to list with whom. So you need to be specific here. And a question that came up on the listserv, consent can be obtained in written form, electronically or verbally, as long as it is meaningful. So I know folks are like, how can we get written consent? So you can get verbal consent as long as it's meaningful, and all of these obligations in the consent form has been gone over. So just to recap this all, I know that it's a lot of information, but before you begin using digital platforms, you want to read the privacy policies of vendors and ask questions, safety plan, inform participants of privacy and security risks, offer options, obtain consent, and really reassess this after COVID-19. Think of this digital service provision as temporary for now. And with the information that you learned today, you don't necessarily need to stop what you're doing or what platforms you're using, especially if you already paid for it. But take the time to tighten up your consent forms and your policies in case there is a privacy breach. And so some of your organizations might be on month-to-month plans, and it's okay to stop using one platform and change to another. There's a lot of free trials going on right now. So, if you are, or if you do have time with your colleagues, test them out with each other and decide on their usability, and take the time to read through those privacy policies. So I talked about our digital service toolkit. We are going to launch that today, and this is the link to all of to where you're going to find all of our technology safety resources. So we have some tip sheets here that are highlighted in orange. We also have very specific promising practices for digital service delivery. I will mention that we have a link to NNEDV's vendor selection form. So it's basically like a checkbox of things that programs should look for in a vendor. So if you are looking at vendors, print it out and go through it and see what you can do in your own research and your own investigation. We also have other tech safety resources that might be of interest to you. We have a tech safety and privacy toolkit. We have legal remedies. We have database considerations and technology safety planning resources. We also have use of technology policy template guides. So that's all there for you. So I'm really sorry that we went over. I didn't intend it to be. On behalf of BCSTH, Nikki and I would like to thank everyone for joining us today. We hope you learn more about providing digital services to women experiencing technology-facilitated violence, or just like women experiencing violence and folks that are that you work with on a daily basis. Please don't hesitate to reach out. My contact information is here on your screen. It's probably best to email because we are working remotely right now, but I'll do my best to get back to you. If you have any questions, please respond in the chat to everyone or to Nikki, and she'll post them here. I am going to stop the recording, so if you need to go, definitely you can go. And we'll follow up with an email later today. So thank you so much for sticking with this, and I'm going to just stop everything stop the recording now.